In early American communities, mentally ill patients were seen as people who were possessed under demons or spiritually imbalanced. Colonists believed the only way to cure them was to keep them contained in small, dark spaces. As a result, many mentally ill people who committed crimes were often forced into prisons with normal people, and their mental issues weren't addressed by anyone. From 1700s to the 1820s, in the United States, mentally ill people were routinely confined in prisons and jails. As mental patients were kept in prisons and in jail cells, doctors made regular visits in order to help calm down the patients when they got out of hand. Dr. Benjamin Rush, the father of psychiatry, had many methods to cure the mentally ill, which later led to reformation in psychiatric methods and more doctors practicing his methods.
Well, many people think mentally ill are because of demonic possession or a spiritual possession, religiously. But we here understand that mental health issues are the result of disease in the brain, and our job is to cure it. Well, in the prisons that I worked at, I instituted the tranquilizing chair, which controlled the blood flow to the brain, and it allowed us to lower the pulse rate for the people that were sick. I have also performed bloodletting, which is allowing a lot of blood to leave the person's body to calm them down. These things may seem cruel to the more modern eye, but this is all we can do in our time.
Other psychiatrists had also performed cruel methods in curing the patients. For example, insulin therapy was also a popular treatment in which patients were given large amounts of insulin for schizophrenic patients in order for them to calm down and slip into a coma, which induced seizures. Another method used by many doctors was the straitjacket. This restraint was a jacket with long sleeves and buckles that allowed for some freedom of movement, but did prevent the patient from harming themselves and others. The straitjacket was also used with seclusion as a punishment or to calm down the patient. This was considered a more humane treatment compared to the ball and chains used before.
In the 1800s, subjects that were taboo in the past were being brought to light. While identifying with her own mental battles, Dorothea Dix realized the mentally ill needed to be treated better. She established official mental institutions for the mentally ill patients instead of putting them in prisons and hospitals where there was no proper treatment of the patients. With the help of Dr. John Galt, Dorothea Dix was able to institute the first Eastern Lunatic Asylum in Williamsburg, Virginia, which was also the first publicly supported psychiatric hospital. One of the major procedures in psychiatry at this time was the lobotomy. The lobotomy was used for schizophrenic patients and those with mood disorders. The procedure included an ice pick being forced into the eye, cutting the connections between the frontal and prefrontal cortex. The result of this procedure caused loss of self-awareness, self-control, and emotions for the patient.
Personalized Recovery-Oriented Services, also known as PROS, is a comprehensive recovery-oriented program for individuals with severe and persistent mental illness. The goal of the program is to integrate treatment, support, and rehabilitation in a manner that facilitates the individual's recovery. Goals for the individuals in the program are to improve functioning, reduce inpatient utilization, reduce emergency services, reduce contact with the criminal justice system, increase employment, and to attain higher levels of education and secure preferred housing. This shows a great difference between what happened in the past when these institutions were created in comparison to what happens now. Mental disorders are not seen as deadly, but rather as treatable and can be lived with. Programs like this have a tremendous positive impact on the lives of mental patients and create a healthier environment. In the 21st century, there is a different light being shined on mental disorders. Even though most of the reasoning and thought behind it is unknown, there are many improvements being made to even further accommodate those with these illnesses. With the help of the science community, many people today with mental illnesses are still able to be contributing members of society.
The mentally ill, many people think they're because of demonic possession or spiritual. Ah.
Hi, Lily. Come here. Yeah, I'm scary. I know. If you pee, I'm here gonna die. Okay, bye. Good time.